All righty. Good afternoon, everyone, and welcome to our monthly All In for Kansas Kids Strengthening Early Childhood in Kansas Systems Building webinar for April 9th, 2025. My name is Julia Gruss. I am your facilitator for today. I am also a research project coordinator at KU's Center for Public Partnerships and Research. I'm also joined by my colleague, Brianna Houston, who will be dropping any relevant links into the chat as we go throughout our presentation today. So be on the lookout there. She'll also monitor the chat as well if there are any questions throughout the presentations. As always, this webinar series for 2025 is held on the second Wednesday of the month. If you want to stay up to date on all of our early childhood systems updates, you can sign up to receive the weekly All In for Kansas Kids e-newsletter. And you can do so by going to the Children's Cabinet website, which actually I did not update that slide. It is www.kschildrenscabinet.gov now. I think if you put org, it will still take you there, but it is a .gov now. And today we are also joined by Maddie Wegner of the Kansas Department of Health and Environment, who's going to be co-presenting with Allie Braun and Rachel Harper on some updates on Help Me Grow Kansas, 1-800-CHILDREN, and some information on the family systems consultants. And after they are finished presenting, we will give you some early childhood systems updates and let you know some future dates. So we'll get right into it, and I'm going to throw it over to Maddie, who is going to get us started.
Hello, everyone. I'm Madeline or Maddie Wegner, and I'm the Child Health Consultant in the Bureau of Family Health at KDHE, and I'm also the state lead for Help Me Grow Kansas. I'm really excited to be here today. I plan on walking through the Help Me Grow framework and how each one of the 4 components of the framework work together to support families and children across Kansas, and share more about our new Books, Balls, and Blocks events. First, we'll do some introductions. I have Rachel Harper here today. Rachel, if you just want to say hi, introduce yourself.
Hi, good afternoon. My name is Rachel Harper. I am the Prevent Child Abuse Kansas Assistant Director at Kansas Children's Service League.
And then we also have Allie.
Hi, everyone. Good afternoon. My name is Allie Braun, and I'm the Family Systems Consultant at KDHE.
Thank you. Can go to the next slide. Okay, so Help Me Grow is a framework designed to promote the healthy development of young children by connecting families to the right services and supports they need at the right time. Help Me Grow, it's not a standalone program, but it's a system building model that brings together existing resources and strengthens coordination across sectors like healthcare, early childhood, family support, and more. Using the Help Me Grow framework as a guide, Kansas early childhood decision makers, programs and services, and community leaders can direct or leverage investments and resources that support child and family well-being in Kansas. Next slide. Oh, actually, could we go back for a sec? These are the 4 components here: family and community outreach, provider outreach, centralized access point, and data collection and analysis. These are essentially like the building blocks, and when working together, they create a strong integrated system for supporting young children and their families. So we're going to take a look first at the big picture vision that Help Me Grow has, and then as we go through the presentation, we'll walk through each one of these 4 components to take a look at what's currently happening and also what our plans are for the future. So our vision for Help Me Grow Kansas is rooted in building a strong connected system that supports every child's healthy growth and development, no matter where they live or what challenges that they face. Help Me Grow works to promote and educate about developmental screenings. So we want every family and provider to understand the importance of screenings and also have access to screenings. We want to expand high quality closed loop referrals, making sure that no one is falling through the cracks and our system is working not only with families, but for families. We help advance this idea by connecting established community collaboratives across the state. So there's so many incredible things happening in many different regions, and we want to be able to unite those efforts to reduce duplication and share best practices across all of Kansas. We also prioritize health provider engagement, training, and feedback. So we want pediatricians, nurses, and other health professionals to feel equipped and supported in identifying developmental concerns and referring families. All of those points sort of come back to the no wrong door approach. So no matter how a family enters the system, whether it's through healthcare, childcare, school, community agencies, they should be able to get the help that they need. And we use like I said, those 4 components in the framework to work towards achieving those goals. So we can start with the first, which is our centralized access point. This is where families, caregivers, providers can go for information, support, and referrals. And in Kansas, our centralized access point is 1-800-CHILDREN, who we have Rachel here today to speak more about the program in a second. But the overall goal for the centralized access point is to make it easy for families to get connected to what they need. 1-800-CHILDREN offers information and referrals based on the individual's needs in searches on their website, which has an up-to-date resource directory. We hope that the centralized access point is the go-to place for questions about child development. And that's for, if you're a parent, guardian, childcare provider, health provider, it's available for everyone. So I'm going to pass it over to Rachel to share a little bit more about 1-800-CHILDREN.
Great, thank you. Would you go to the next slide, please? So our 1-800-CHILDREN provides judgment-free support. Maddie kind of shared a little bit about what we do. Families can easily connect with the information, local resources, and the support 24/7. And our 1-800-CHILDREN team is made up of a supervisor and 1 family resource specialist in our Topeka office. And then we have 2 family resource specialists in KCSL's Wichita office, including 1 bilingual staff, English and Spanish. And then we have a long-term volunteer who also assists with those after-hours calls because we are 24/7. And our staff are trained in motivational interviewing, Triple P, which is the Positive Parenting Program. It's a parenting education program. And then the Standards of Quality for Family Strengthening and Support. So that's through the NFSN, the National Family Standards Network. And then our staff and volunteers are trained in mandated reporting, as well as active listening and de-escalation techniques. Our staff and volunteers, they have that lived experience. Parents, 1 staff is a graduate of one of our Healthy Families home visiting program. You can go to the next slide. So there are no questions. No question is off limits for our 1-800-CHILDREN staff. And there are 4 ways a person can access support by calling that 1-800-CHILDREN or 1-800-332-6378. That's our original parent helpline number, and then we rebranded to 1-800-CHILDREN. By sending an email or a text, again, to that 1-800-CHILDREN@kcsl.org. They can access support by visiting our 1-800-CHILDREN-KS.org resource database, which is on a computer and also available as a mobile app. Then there you can find the resource listings from across the state. And then, like I said, downloading the mobile app is available on the Play Store or the Apple Store. So would you go to the next slide?
Actually, Rachel, can I interrupt for a second and
Yes,
just ask
please.
a question from the chat? We have a question from Natalie McLean asking if they want to add a program to that 1-800-Children resource directory. How long does it typically take from the time that they suggest the program until it starts appearing on the site?
So it shouldn't take that long. What happens is that when you go in and request that, then Find Help, who oversees the database, goes and does that research to get all the information to make sure that everything is current, everything is up to date, and then it gets added to the resource database.
Thank you so much.
Yes, thank you.
Mm-hmm.
All right, we'll go to the next slide. And so, as I said, this is accessible to all Kansans. It is a statewide program. It is available 24/7, 365, available by phone, email, text, website, mobile app. So multiple ways to reach out to a 1-800-Children staff or to reach out to the resource database. There is no cost. There isn't any eligibility or income requirements. We do have an access in over 200 languages, and that is for the phone calls, because we have our bilingual staff, but we also have a language line. And then on the actual resource database website, it is also available in over 200 languages. It is anonymous. And it is available to anyone: parents, caregivers, professionals, grandparents, aunts, uncles, friends, just anybody who is, in a child's life and has questions about that child development or needs support or resources. You can go to the next slide. So again, it's just one here. So our 1-800-Children KS, like I said, it's built by Find Help, and they maintain our database. And there are currently over 5,400 resources on the site. That includes local, state, and national level resources. So one feature that drew us to partnering with Find Help was that the dedicated team for continuous updating and verification of resources. So that's what I was kind of talking about when you go in and suggest a program. There is that dedicated team that goes and verifies all the information, and then it's updated. And so once that resource has been added, it is reviewed for needed updates by a real person at minimum every 6 months, and consistently ensuring that reliable resources are for families. Next slide. So here I'm just going to walk through how to search on the database. So you start by entering the zip code of what area you are looking for, whether that is, the area you're in, the area that the family in that you are wanting to support or provide resources for. So like I said, on the home page, you see that field for your zip code. And at the bottom left side of the page, you can translate that website into over the 100 languages. So that's where I was talking about. You can change the language to what it is that the user is needing. And then to highlight the buttons on the bottom of the page here, users can click on to call, email, or text to contact 1-800-Children staff or our volunteer. And then there is also a way to claim a program. So down here at the bottom where it says claim a program or suggest a program, that's where you can go in and if you are a provider or you are involved with a program, you can claim that. And by claiming that allows a person to set up, to turn on the referral button. So families and caregivers, parents, just anybody can actually, if the referral button is turned on, they can self-refer to a program. And then that suggest a program button here too is if you are looking for a resource and you don't see that in the database, but you know that there's one out there, you can suggest a program, and then that Find Help team will go in and again, do the verification and get that updated and added. Next slide. So then after you enter your zip code, you can then use the search bar or the category bar up here at the top to find the resources that you need. And then at this point, the database has already filtered the resources so that only resources that serve that specific zip code and the surrounding areas are listed. We can go to the next slide. And so as you can see, as you go over the categories up here, there are some drop down pieces to that. So under health, you can see there's insurance, medical supplies, end of life, all the different components here. There's mental health and substance use. And so you could click on that, and it's going to bring up those programs again that are within that area that you searched for. You can go to the next slide. So then once you've done that search and you've clicked on a resource and you're looking for more information, the provider card, so you can see where it says more information, then it drops down, that's the provider card. And so it lists the program along with some basic information such as the services provided, who they serve, and how to contact them. And then you can also receive information on languages are offered and those eligibility requirements for that resource. And then anyone can also click the share button. And so right here, and then you can email or text that information from that program to yourself or someone else. So again, if you were searching for somebody and looking up resources for somebody, you can share that with them by email or text. And then the suggest buttons allows you to submit a suggestion to edit a program's information. And so that is right here. And if you notice, that way, if you notice that any of the information is no longer accurate. And then like I was talking about, there is a way for a program to turn on that referral button so that, again, families, people searching, they can refer themselves. You would receive that contact information, and then that resource would reach out to them. Or you can also be able to refer a family that you are working with. And then we can go to the next slide. And then was this you, Maddie?
Yes, it was.
That's what I thought. I'll pass it back to Maddie.
Thanks, Rachel. So Help Me Grow Kansas and 1-800-Children, acting as our centralized access point, are working together to strengthen and expand our shared efforts. We're working towards a more streamlined system that includes short-term care coordination, direct connections to service, and consistent follow-up to make sure families are receiving care, not just a phone number or cold handoff. We're deepening partnerships with community services and providers to ensure referrals are working both ways, and providers are aware of how 1-800-Children can help fill in the gaps when it comes to developmental resources and questions. And then in partnership with the Family Advisory Council, who we will be hearing a little bit more about in a bit, we're focused on improving search experience and results, making sure that the resources that are popping up are accurate, and really embedding that family input into every layer of the system. Okay, next slide, please. This is the second core component, which is family outreach and engagement. It is all about increasing awareness, building trust, and making connections. So we're working to raise awareness of services available to families, while also making it easier for them to access resources such as developmental screenings, parenting support, local programs. Our outreach also helps us promote early development, surveillance, and screening by educating families and providers on why early identification matters. Our goal is a system where families feel informed, supported, and connected to what they need, the services they need, and the providers that they're interacting with. Next slide, please.
I've got another question in the chat, so whoever is able to answer this, if you can. Lisa Williams was recently introduced to a program that was called Unite Us Kansas. Similarly, it is a digital referral communication system. She's wondering, how does 1-800-Children and Unite Us Kansas work together to coordinate services, and when should a family use one resource or the other?
Yeah, so I can take that. So we have actually been in communication and having conversations with Unite Us on how 1-800-Children Unite Us can work together. And so we're looking at how to coordinate those services. But the question about when should a family use one resource or the other, I would say that one of the advantages of using 1-800-Children and using the call line and calling and talking to somebody is that a family is reaching out to a person that is local. So they're in Kansas, and that they are also trained in how to, in that parenting, that motivational interviewing, and working with families and being able to support them and answer those questions. Is one of the, what I would say is one of the advantages for using the 1-800-Children.
Thank you, Rachel.
Okay, so we've kind of separated this section into two parts. First is our outreach, and then second, we're going to dive into engagement. We will be bouncing around a lot in this section because there is a lot going on here, which is really exciting, but stick with us. I promise it all will make sense. So last year, we hosted parent and caregiver fireside chats to hear directly from families, have them share their experiences, and ask questions on the specific theme of the fireside chat. These conversations really help us understand what the real needs are, what the real experiences are, and how to shape our work accordingly. We're also adding a family leader role, which I'm super excited about, to the Help Me Grow core team. So creating opportunities for parents, caregivers to be more involved as partners in shaping the system, not just participants, but being a part of the decision making. These are just a couple examples of regular feedback loops that we use to directly inform our work and hope to expand in the future. We use tools like the Ages and Stages questionnaire, or ASQ, to support families in monitoring their child's development. An event like our new Books, Balls, and Blocks project offer fun, hands-on ways for families to engage in early learning and developmental play. I also have a QR code and link there to the Help Me Grow Kansas website. It has resources for families and providers. Can go to the next one. Very excited to share more about Books, Balls, and Blocks. These events are designed to make developmental screening more accessible and convenient for families. This project is funded by the Preschool Development Grant, or PDG, and in the first year, we are planning to partner with a couple of childcare providers to do these events. So a little breakdown of what an event would look like. So before, Help Me Grow would work with the program to prepare family-facing ASQ pages online and help families understand what to expect. So we can help make a flyer or an announcement or handout or whatever the provider may need to prep families for the event. On the day of the event, families will have the opportunity to complete the ASQ on site. We're hoping this might happen around like pickup time to be as convenient as possible. So the ASQ typically only takes about 10-15 minutes for families to fill out. And it is an interactive tool between the parent and the child. So everyone would be involved there. We'll make sure all the materials needed, like the books and balls and blocks to complete the ASQ, will be available to families there. We'll set up like play and learning stations around the area, and a Help Me Grow representative will be available to provide real-time support or troubleshooting when it comes to the online ASQ platform or just any questions that may pop up. After completing the screening, families will receive a little take-home kit with developmental resources, books from Dolly Parton's Imagination Library, printed copy of their child's ASQ results, so they will have an online copy and a printed copy, and then some Help Me Grow goodies in the bag too. And then following the event, based on the screening results, 1-800-Children can help connect families to appropriate services such as local infant toddler services or school district early childhood education services, and tailor resources to that child's specific needs. Child care providers will also have the option to use the 1-800-Children call line or website for ongoing assistance to help navigate resources directly with families after. So we will be partnering with 2 child care programs this year. We actually hosted our first Books, Balls, and Blocks trial sort of event at the Parent Leadership Conference last September, and we are planning on doing one again this year. I'm super excited. And then in year 2, which starts October 1, we are looking for new partnership opportunities with childcare providers or with different community events. We can do Books, Balls, Blocks in either setting. And we're also hoping to create trainings for people to be able to replicate this kind of event. So we have an interest form that the link will be going in the chat for. It's not a commitment by any means, but just sort of a running list to get a good idea when we do start year 2, who may be interested in participating and hearing more about Books, Balls, Blocks. And then another way to receive the ASQs with 1-800-Children. So Rachel's going to share a bit about that.
Yeah, thank you. So through our 1-800-Children staff, that in spring 2022, we began offering that ages and stages questionnaire screenings. And if a caller calls and they're concerned or curious about the development of their child, 6 and younger, a trained staff member can help the caller complete the ASQ screening tool, and then connect the caller to services as needed based on the results of that and what the family is requesting and interested in. The parent completed part of the screening is typically sent to parents electronically and then scored by the staff person. So that we're mindful of callers who wish to remain anonymous, because there is, our 1-800-Children call line is an anonymous, it can be anonymous. We can also complete the screening entirely over the phone and then connect the family with resources and information. I'll pass it back.
And I will be talking about the Family Advisory Council now. So the Family Advisory Council is from the Bureau of Family Health, and it's also known as the FAC. It is made up of families across Kansas who provide guidance to KDHE on how to best support mothers, infants, children, and youth, and also children and youth with special health care needs as well. Next slide, please. So the FAC meets 4 times a year. We have 3 virtual meetings and then 1 in person. That in-person meeting just depends on, location depends on what is best for the members and what works best for everybody involved. And then during the council meetings, there's time for whole group discussion. We typically have KDHE updates that we give to them, ask about if there is anybody from our consultant unit that has things that they would like to be reviewed by our FAC members. They are able to do that during that time. And then we have somebody from KDHE usually talk about a program that they have going on. And then we have an outside presenter as well that comes and talks about within our state, that talks about what they're doing and how they could possibly be connected. There's also work group time at the very end of the meeting where the groups are given time to work on their project, and the projects that are selected are based on the current Title V state action plan. Next slide, please. Our current populations that we serve or our work groups that we have are women maternal group. We have an early childhood group that's birth through 5, and then we have a child group 6 through 11, and then adolescent ages 12 and up. And then we also have our children with special health care needs group. Next slide, please. So the child and adolescent group paired up to present at the Parent Leadership Conference in September 2024. Their presentation was on parent feedback, and there was great discussion and participation with the participants there. And hopefully we plan to get them involved in the Parent Leadership Conference again this year. And the Children with Special Health Care Needs group and Early Childhood group are working with 1-800-Children this year to review the resources that they have listed on their database that was talked about before. And if there's any programs or that are missing or that just need updated, the Early Childhood group is going to work, and the Special Health Care Needs group is going to work to update those. And then the Special Health Care Needs group has really taken on also to make sure that there's resources out there specifically for that population. Next slide, please. So after reviewing the current representation on our FAC, we noticed that there's a lack of members with children under the age of 5. So to address this, we plan to attend community baby showers, family community events to be able to promote the FAC along with Help Me Grow Kansas to get kids screened. So we plan to also expand our FAC work group to include fathers and / non-birthing partner work group, because we do see that that is one area that we are a gap that we need to be filling as well. And we do see them as a valuable part of the family unit as well. And then I will pass it back to Maddie. Next slide.
This is our third component, which is child health provider outreach. We partner with child health providers to support developmental surveillance and screening, and to make sure they know how to connect families with the right services. So it's really about building bridges between medical care and community resources. A couple activities or updates. We have a physician champion role on our Help Me Grow core team, and we have found someone to fill that role, which is very exciting. They will be responsible for creating a developmental screening or ASQ screening training directly for health providers to be able to walk through how to make that applicable to a health or clinical setting, and also go over where to refer based on the results of the screenings. And this is in partnership with Kansas Kids Map, and they will also be offering children's behavior and mental health training to kind of go hand in hand with the screening training. And then we help health providers connect with community services and organizations. So Rachel's going to share a little bit about how 1-800-Children can help make those connections.
Yeah, so I kind of talked a little bit about this already, but looking at how to add and claim programs. And so we do have this quick reference guide for providers, and the document goes step by step through how to update, add, and claim a program, and to be able to turn on that referral button so you can receive referrals. And please contact Michelle Riker. She is the supervisor for our 1-800-Children program. Or you can call 1-800-Children to receive the guide. But it's super easy to do. And if you're interested, just reach out and we'll make sure we get you that guide, and we can walk through it with you. We can do trainings. We can do whatever is needed to make sure that we have the most up-to-date resources for our Kansas families. I forgot this one was mine too. So in all of the other things that we do with answering the phone line and being available for families, we also want to make sure that we are doing that outreach to families and communities and providers so that we're continuously spreading the message and information. So we do presentations, attend virtual conferences, coalition meetings, team meetings, parent groups. We can partner with childcare facilities and do sessions with their parents on how to use, research and look for those resources, we can also, like I said, work with programs and train them on how to add and claim and turn on that referral button. We have booths at professional conferences and community events. We make sure that we're distributing those materials to organizations across the state. We do have that available through our KCSL website to also order any 1-800-CHILDREN materials that you would like to have in your office to share with families. We collaborate with community partners. So, Allie was talking about that we've been collaborating with the Family Advisory Council so that, we can make sure that, again, our resources are up to date and that they are usable for Kansas families. And then we also are working on a social media and radio streaming campaigns. We can go to the next slide. So these are some of those promotional materials that I was talking about that are available. And then we have the family outreach card. So you can see that on the screen. It's available in English and Spanish. As well as magnets, palm cards, and hand sanitizers. And then the QR code right here, you can scan that and that would take you to the order form so that you can order those. And those are free for any provider that would like to have those available for your families. And we just appreciate if you're interested in doing that, we'd love to make sure that we're partnering with you so that we can continue to send that information out and get it to the Kansas families that are in need. Thanks.
Okay, we made it to the fourth and final component of the Help Me Grow framework, and that is the most thrilling part, data collection and analysis. So this helps us support evaluation, see what is happening in our state, helps us identify systematic gaps, and bolster advocacy efforts to guide quality improvement. We want to ensure that as a system, we're all growing and learning from this work, and data is a great reference point and motivator to be able to see those specific areas where we're doing great or need improvement, and really continue the work there. So we're modifying how we collect our data for Help Me Grow. For greater fidelity, we do a yearly fidelity report to Help Me Grow National. And we typically we're doing yearly reporting. We're now going to do quarterly reporting with the eventual hopes of making a dashboard that we can put on the Help Me Grow website and will be available to the public. This also helps, we look at our data, creating that family and provider feedback loop. So one of the ways that we've done that is through the care coordination survey. We wanted to better understand care coordination roles and activities in Kansas to identify and build on strengths as well as understand those gaps. So we sent out one survey to families and another survey to care coordinators. Go to the next slide. And the full analysis is not finished yet, but here are just a few things we were able to initially pull from the results of the survey. It shows that KDHE staff reports providing screenings. 90% are providing screenings to use the results to inform what services and referrals they're providing. Families are strongly agreeing that referrals received from providers are meeting their needs. And we're looking forward to getting the fuller picture. And we'll dive deeper into topics like referral patterns, how providers support families during crises, and opportunities to strengthen those referral and intake processes as well. So be looking out for that full report coming soon.
And so this is some of that data that Maddie was talking about for 1-800-CHILDREN. This is for January to December 2024. And that we had 1,618 total calls. That is one of the reasons why we want to continue to do that outreach and get that information out there so we can increase those calls. Our interactions, which is visitor activity that indicates the user is trying to learn more about a program. So they are, researching, looking for resources. And so that was at 35,021. And then those connections, which is that visitor activity, which means that they actually contacted a program by clicking on an email address or website link. And that was 3,323 connections made in 2024. You can see that some of our top reasons for the call, the top reason is that program information. So they're, calling, wanting information. And then utilities, so they're looking for resources to help with those utilities, and then child abuse and neglect concerns as well. And then the top search terms through the database, housing assistance, that mortgage and rental assistance, and then parenting classes. Those are the top three. You can see the other ones as well that are listed here that our Kansas families are searching for. Thanks.
All right, and just as a sort of heads up for what is coming in the near future, as I mentioned previously, our physician champion is joining us in summer 2025. So hoping to have those developmental screening trainings for providers ready by the end of the year. And then if you're interested as a child care provider, or if you have a community event that you host, in bringing books, balls, and blocks to your program or event, we just put a link in the chat for the interest form. Again, it's not a commitment, it's just sort of a raise your hand if you would like more information kind of thing. So please fill that out. And like I said, your 2 starts in October, so it might be a little bit before you hear from us, but you will be on the list if you fill out the form.
And then some things that are coming soon for 1-800-Children. So we are looking at doing more with our website through Find Help. We are looking to add assessments onto the website that people can go on. You can complete them yourself and be able to connect to resources, referrals. And we're really excited about the prospects of what more we can do with that resource database. So that is more to come on that. And then the other thing is, I know that Maddie had mentioned that we had that Books, Balls, and Blocks event at our Parent Leadership Conference last year. And so our Parent Leadership Conference for this year is going to be in summer 2025. We're excited to have that event among other really good breakout sessions and keynote speakers and just the connections. So look for more information to come out about that Parent Leadership Conference.
And then I just have an update for the family leadership training plan. So it's been something that's been talked about for a long time with the FAC and families across Kansas. And it's been a need that families need a training. How do we learn to advocate? How do you learn to lead as a family member? And so we have decided to bring a training to Kansas that empowers individuals to become strong family leaders within their communities. So we plan to work alongside Help Me Grow Kansas to have their family lead or leaders be a huge part in developing this training. So while much of 2025 will be focused on exploring different programs that are out there, we've met with Iowa State University. They have an incredible family leadership training. So exploring that program, learning what is already out there, and then excited to be able to develop this training coming soon. So stay in tune with us for more updates as we move forward. Also, I forgot to mention before, if you are interested in joining the FAC or know of anybody who would like to join the FAC, please, will be an interest form that's dropped in the chat, and please fill that out. We'd be happy to have you join our team. Thank you. I think it's question time.
Yes, we appreciate the questions thus far. If anybody else has a question, feel free to drop it in the chat or come off mute and go ahead and ask. Right, I'm not seeing anything come through in the chat, but as you can see on the screen, you've got the contact information for Allie, Maddie, and also Michelle Reichert with KCSL. So if you have any questions, you can always reach out to them directly. But I want to give a big thank you to Maddie, Allie, and Rachel for presenting on this today. Oh, we have one question. Have you reached out to the Head Start Association to talk with them about these great opportunities?
Not yet. So we're working on building out like the Books, Balls, Blocks events this year to pilot it. So we kind of work out the kinks and figure out what we're doing and how to be the most helpful. But that's a great suggestion for year two partnership. So thank you.
Awesome. Well, thank you again to our presenters. We appreciated all the information you presented on today. It was extremely important and a lot of good information for everybody. So thank you again. And we will move forward with our early childhood systems updates. Just have a few of those for you before we wrap it up today. First, the Early Childhood Recommendations Panel is now accepting applications to join the next round or term of the recommendations panel. So the Kansas Children's Cabinet and Trust Fund convenes, directs, and appoints the members of the recommendations panel. Volunteers apply to be considered for panel membership, and each annual term begins on July 1st. Panel members meet monthly, examine policy, discuss ecosystem needs and priorities, and vet recommendations from public input. The panel then elevates vetted proposals to the All In for Kansas Kids leadership team and the Kansas Children's Cabinet. So those applications are being accepted now through May 2nd for any Kansan interested in serving on this working group for the Kansas Early Childhood Advisory Council, known as the Recommendations Panel. You can visit the Kansas Children's Cabinet and Trust Fund website to learn about the knowledge and experience that is represented on the panel and how you can share your voice in this important work. And any interested parties can also view past meeting recordings so you can get a feel for what happens at these meetings on the Children's Cabinet YouTube channel. And then there will be a link in the chat as well where you can learn a bit more about the panel if you are interested in getting involved. Next, we have some funding opportunity through Northwest Kansas Economic Innovation Center, some childcare grant initiatives that will support Northwest Kansas childcare facilities and providers. So there is the Childcare Multi-Purpose Grant that would give childcare facilities and providers the flexibility to apply grant funding to their most pressing needs. And then the Early Childhood Education Staff Retention Grants are designed to provide financial recognition for early childhood staff, reduce costs associated with staff turnover, and to hopefully stabilize the workforce. So applications for these funding opportunities, the deadline is April 25th. So if you are interested at all in those childcare grant initiatives, you can learn more by going to the link that Bree just put in the chat for you. And then next, I have another colleague of mine, Ashley LaFond, who is going to pop on here and give us some information on the care and wellness conferences that are coming up in May.
Thank you, Julia. And thank you all. I'm really glad to be able to be here today with you. And thanks again, Madeline and team, Rachel, for informing us all about your important work. So yes, as Julia said, I'm Ashley LaFond. I'm a research project coordinator here at CPPR, and I'm leading the efforts of our upcoming regional care and wellness conferences. So some of you may on this call already know or have heard a little bit about it, as I've been I've heavily recruiting the past week or so. But we are planning 2 one-day conferences, one in the Southwest region and one in the Northwest region. We'll be in Garden City on May 6th at the Russell Child Development Center. And then in Hayes on May 8th at the Hilton Garden Inn. These are both free to attend. They and will provide opportunities for networking, collaboration, knowledge sharing, really just trying to kind of create that third place for everyone to come together. The conferences are open to families or anyone expecting a child or caring for a child aged birth to 5, early childhood professionals, and mental health providers. Um, uh, with the PDG grant, and planning this, that we really wanted to have this conference designed so that it would give an opportunity to let everyone, from those 3 different demographics, if you will, that I mentioned, come together, meet, and share experiences around mental health and special healthcare needs with with professionals and other families, and really create a space for real conversations, resource sharing, and skill building to help support your work, and also for those who are there as a family member, and helping with parenting and caregiving. Um, this event will feature an opening panel hosted by KAME, Kansas Association for Infant and Early Childhood Mental Health, and with discussions on early childhood mental health led by a family or families with lived experiences, um, really to model effective parent-provider conversations, normalize discussions on mental health, and empower parents to advocate for their children's well-being. Throughout the day, there will be other sessions that will cover topics around wellness, early intervention, specialized healthcare needs, behavioral health, neurodevelopmental disabilities, and a lot more, and just input from a variety of expert partners of ours on the PDG grant. In the afternoon, there will be an afternoon panel discussion led by Peggy Kemp with KITS, and it's called Centering the Family Voice in Early Intervention. And it will highlight how empowering the caregiver's voice and building partnerships are key strategies within early intervention. And then in the afternoon, we'll have also some breakout sessions, and people can choose to attend sessions that, would be applicable or of interest for them. And those are led by our partners with Lind, led by Stephanie Coleman. That one is called Difficult Conversations Around Discussing Developmental Concerns with Parents. In Hayes, there will also be one from Lind led by Jessica Shuttler called Links to Learning. And then we'll also have Mindful Minis joining us to lead 2 different sessions, one with a focus for early childhood professionals to lead, early childhood professionals as well as families. So there'll be 2 different ones for people to attend. And all around that will be sort of focusing on empowering, empowering families. Their approach is called the CARE approach, which stands for connect, accept, regulate, and empower. And it provides people with a framework to strengthen their relationship with either their children and support their development, or to also help childcare professionals foster meaningful interactions with children, their staff, and parents. So at each conference, I know I'm giving you a lot of information. I just want to make sure you all know about it. There'll be a resource area for people. So if you, anyone on this call or know organizations that would also be interested in joining and sharing out materials, we will have time during the day during the lunch hour for people to share out about their organization and resources available to people in those communities. That could be local, of course, or statewide. that is free. That option is free to participate. The whole day is free. The lunch will be also provided for everyone that comes. And then also for families who attend, we know that it can be really hard for people to get to the events like this with schedules and childcare. So there will be stipends available for families that participate, specifically those with young children from birth to 5. And then also all these sessions that I mentioned to you will be available for people to earn, for early childhood professionals to earn KDHE approved in-service hours. So it's a great chance to get some professional development under your belt while also, getting to connect with others. So that's it on the conference. I just, after hearing a bit more about the conference, if you are interested in joining, please, we'd love to have you. Brianna's sharing in the chat links to register and flyers also if you want to share those out with people in your networks or other, families that you may know that would be interested in joining. We would love that. And if you have any other questions and want to connect with me or have ideas, please do. My email is, I'll put it in the chat here. And I would just, I'd love to connect with you all. And that's all I have on the conferences today.
Thank you so much, Ashley. Yes, like she said, please register for those events if you are in or around Garden City or Hayes and are interested in attending those care and wellness conferences. Yeah, we're very excited about those. Lastly, I just have a few reminders and next steps for some upcoming meetings. Our next early childhood recommendations panel will be held next Friday on April 18th from 9 to 11:30 a.m. Our next early childhood systems building webinar will be on Wednesday, May 14th, as always from noon to 1. And next month, we will be joined by Emily Barnes from Kansas Action for Children, who is going to speak to what it takes to advocate for yourself as a childcare professional with local lawmakers, as well as how to build relationships with lawmakers within your local government. She's extremely excited to share this information with everyone, and it should be a very interesting and empowering presentation. So if you are available on Wednesday, May 14th, I suggest you join us again next month. And then the next Children's Cabinet meeting will be held on Friday, June 6th from 9 to noon. And as always, you can find these meetings on the Children's Cabinet YouTube channel, where I know that the Early Childhood Recommendations panel is live streamed on that Friday. And then the recordings are there for you to watch at any time. So thank you very much, everyone, for joining us today. Thank you to our presenters once again. You can stay up to date with All In for Kansas Kids by signing up for that e-newsletter and also subscribing to the YouTube channel. I hope everybody has a wonderful Wednesday and a great rest of the week. Thank you so much.